Hello, everyone. Welcome back to the Goody Life, where life is good and everything is great. I'm Dr. Goody, and if you're new to my channel, the Goody Life is all about finding motivation, inspiration, and self growth in all different aspects and areas of your life. And this week, we're continuing with health and wellness. And what we're going to be talking about today is lactation and the benefit of breastfeeding. Now, if you've been watching the last few videos, we've already touched bases with a doula, a nutritionist, and I wanted to bring in a lactation consultant where she can talk about the importance of breastfeeding. But not only that, even if you chose not to breastfeed, that's okay too. So we will be touching bases on both subject today. So with that said, help me welcome Kendal Vaughn, our lactation consultant, as she talked to us about the importance of breastfeeding, whether you choose to do that or if you're doing formula. And welcome.
Thank you for having me. I'm excited.
Yes, I'm so glad you can join me in this journey and this month as I talk about health and wellness for soon to be mommies. And today, one of the most interesting and exciting topic that I want to talk about is lactation and breastfeeding in general, the benefits of that. And I know a little bit about you, but I'd like for you to just give us an intro about yourself and what got you into lactation consulting.
I've been a lactation consultant for over 5 years now. But I like to say that I took the scenic route to get here. I come from a family of nurses, and I said I would never ever be a nurse. And I started out as an LPN. And I got very, very lucky to get straight out of school into the mother baby unit, and I fell in love with it. And from then I was a young 22-year-old, trying to educate moms on breastfeeding. And it's funny now looking back, a lot of moms would ask, like, are you still in high school? And here I am trying to educate them. And then, fast forward, I got my registered nurse and I became an RN. I was a floor nurse for a really long time. I worked in the office, I worked in peds, but I always stayed, women's services, babies, kids. Um, and then I went back. I loved the education part and the fact that I could spend a lot of time with a mom and really help her. And so I went and got certified to become an IBCLC, and it's International Board Certified Lactation Consultant. And so I did that and worked in the hospital for a few years with that. And then I've recently went off completely on my own as private practice. I did that 19 days before the pandemic. So it's been an interesting first year, but it's been great too, because I go into patients' homes and I see them. And in our area, I'm in Pensacola, Florida, and in my area, our hospitals are saturated with help, but once you get out of the hospital, there's really not that much help unless you want to load your baby back up, go up to the hospital, which is really hard for a new mom to do. So I'm able to go into their homes and help them and, let them be in their environment and us just kind of work around that. And I take into account, other children that they have, their family, their lifestyle, their routine, all of that stuff, as opposed to being in an office setting and just, it's different. So and then I've since my beginnings of nursing, I have twin girls that are 7 and I have a little boy that's 5. So now I feel very well rounded in breastfeeding and all the things. So it's a huge passion of mine and I absolutely love it.
I absolutely can see where you're coming from when you talked about where you started off, because I started off very young in my career also. And, working in as a clinician, it's always so different when I was younger in my
Yeah.
20s. And I felt like it always had that strange feeling when you're talking to someone else and the first question they ask you is like, do you have kids? And you're like, no.
Yes. Yes.
And as I move on, as I got older and you gain more experience and knowledge, but I also realized the importance and the difference our body actually that we go through, because currently I am pregnant myself. And it's amazing to see the difference and the changes. So along with education and knowledge, which is really, really important, but having somewhat of a personal connection especially when it comes to motherhood and when we're talking about these subject matter, it makes a difference for the mommies out there, I think.
Yes, it's a complete game changer. And I thought I knew a lot going. I mean, I felt very well educated as a new mom going into my delivery and my first kids, and it was a huge eye opener to me because there were a lot of things as a postpartum nurse, as a newborn nursery nurse, that I did not even know about. When I got home, it was a complete shock to me. So now that I've been through all of that, it really changes my perspective and lets me connect on another level with these parents. And it's the best thing ever. I love it.
Yeah, amazing. Thank you for sharing that. And that's one of the things that I like. What I look for when I'm bringing in expert is experience in the knowledge factor of
Hmm.
it, but also some personal experience is always good. So as we're getting into it, the first thing I think that everybody wants to know is, what are the benefits of breastfeeding?
So it kind of, can go a little bit of both ways. So as a young IBCLC, when I was going through school, I was taught all these things, all these benefits. And the more classes that I taught, I realized that some of the ways these are like given out to people can kind of almost set this mom up for the guilt, the failure, if she can't do it and we're honing in on all these benefits, then I feel like it makes the process worse when a mom isn't successful or doesn't want to breastfeed. So the benefits that I teach parents are all based on science. So yes, the the actual breast milk is better for a baby's immune system because it gives you those antibodies to fight infections and colds and all that kind of stuff. Yes, it's better for the GI tract because it's broken down a lot easier. Yes, it does reduce the risk of ear and respiratory infections. But beyond that, that's about as far into it as I go because on the flip side of that, formula is not bad. Formula doesn't cause those issues. It's just digested different. So, and we can't put antibodies into formula. So I don't really get, because I'm a very fed is best type IBCLC. A lot of people, I think, the breast is best and all this kind of stuff. And to be honest, I used to be that way when I was in the hospital. And once I became into like seeing more of these moms in the home setting and, after they leave the hospital, the postpartum depression and postpartum anxiety that comes along with not breastfeeding, exclusively or reaching whatever their goals, to me, that's way more important than what this baby's eating. So, yes, I want them to meet all of their goals, but I also have to be realistic about it. So, it does have a lot of benefits, and there's the bonding benefits of it too, but I hate to even use that because a mom that formula feeds, they bond with their babies too. So there is a different bond there when you're breastfeeding, but I don't want to make it sound like if you don't breastfeed you don't get any of those benefits.
Absolutely. And I'm glad that you're mentioning that, because I guess we should look at it as a whole roundabout, which was one of the questions I had later on as we move into the video. But I'm glad you talked about it right now in the beginning, that you're addressing it. So it's important for moms to know whether you can breastfeed or you can't. It's okay. And your baby
Hmm.
can still get a lot of benefits, a lot of
Yep.
bonding, a lot of nutrition, both ways. This is not a place for
Exactly.
somebody to feel guilty or somebody to feel bad, because a lot of people are not able to breastfeed for a variety of different
Hmm.
reasons, but the kids still turn out very well, very healthy, and
Yes, they do.
moms and their babies have great benefits. So I guess we can look at it more in a sense like, how does it benefits overall?
The benefits for the mom, it does help with postpartum depression and anxiety because it's very relaxing and it's calming and it's comforting for the mom to do.
So one of the things I have been learning a lot about during this period of in my third trimester and attending breastfeeding classes and talking to all other moms is the nipple and the positioning of the nipple and making
Uh-huh.
sure you know how to have it in the right way, and so much information out there. So what are some
Yes.
tips and advice you can share with us about, when we're breastfeeding, when it comes to our nipple and making sure that we're positioning it. Is there such a thing as positioning it the right way, or how to make sure that we're helping the baby to get the best?
Yeah, so that's actually something I love when I do prenatal classes to really focus on this because so I was taught before I had kids, one bad latch can cause a lot of problems and a lot of damage. So if it doesn't feel right, take the baby off and then reposition. Well, as a tired new mom who just got her kids on for the first time, it hurt. But and I heard myself in my head, and I'm like, oh, it's fine. Like it can't be that bad, after one latch. And after my very first latch with my girls, I was damaged for a couple of weeks. It was so bad. So I really talk about how important this is because when you have nipple damage and you're still trying to breastfeed, it can just set you up to like throw in the towel. Because to be honest, mine was so bad that had this not been my job, I don't know if I would have continued because it was so painful. So it is really important to make sure you get that good initial latch. And so the main things to keep in mind, there's really two common holds. It's called the cross cradle hold or the football hold. I always say try both, see which one works best for you. There's not one that's better than the other. It's just whatever you're comfortable with. So making sure the biggest thing is that when your baby is either it's going to be laying sideways with you or football, like you're holding like a football, your baby's ears, shoulders, and hips all need to be in a straight line. So meaning that you don't want the baby laying like on a boppy on the baby's back and then its head turned sideways because it's hard for you to swallow this way. So it's hard for the baby to swallow that way. And also think about if your head's tucked down like this, it's very hard for you to swallow as opposed to being up like this. So really watching the neck position of the baby is a huge factor. Making sure that the baby's belly is facing your belly. So you are belly to belly in a cross cradle hold. And then looking down to make sure that ears, shoulders, and hips are all in a straight line. And then when the baby's coming on, you want that wide open mouth. If the baby's trying to get on the nipple like this, they're just going to kind of clamp down on the tip, and that's going to cause a lot of pain. So you want them to open really wide and then come on. A trick to get them to do that is to take your nipple and go from the baby's nose to their upper lip and just kind of stroke down a few times, and they'll open up really wide when you do that. And then you just bring them on as soon as they open wide.
So kind of like what moms have been doing for years now ago, before all these other cool stuff came out and what we should put our baby on and all the stuff that I'm buying and purchasing. It looks like
Yes.
what my mom or what many people have done years ago, which is holding their baby, making sure it's, facing them in a certain position, works
Mm-hmm.
just fine.
It does. Yeah, it's crazy to me. Just 7 years ago when I had kids, the amount of things that have come out just since then, it's mind blowing.
Yeah.
And, one of the benefits of breastfeeding is that it's free. Well, to these days, I'm like, you're not saving any money breastfeeding because all the things that people think they need to breastfeed, you're in thousands deep already. So the boppies are good, but pillows honestly work just as good. But
Of course.
I'd have to say I'm not a fan of like all the things, that you need. Like I'm very simple.
Sure,
But
sure.
if you are breastfeeding with multiples, I do believe wholeheartedly in that my breast friend pillow. But otherwise, a regular pillow off your bed works just as well.
And that's the whole point here, is just letting moms know to feel comfortable and don't feel pressure, whether you purchase
Right.
something to work or whether you want to try it the old ways that it has always been done, it works. And just knowing how to do it, that's the whole idea here today. This is another big thing that mom feel pressured or sometimes concerned about, is how long to breastfeed. The time
Hmm.
around from birth to, is it 6 months, 1 year? I've heard 2 years at this point.
Yeah.
So is there
Yeah.
such a thing like a specific time frame and how long a mommy should be breastfeeding?
In short, no. So when I go to meet a mom for the first time, every single mom, before we get too far into or to the appointment, I ask them, what are your breastfeeding goals? If you could have it in a perfect world, how long do you want to breastfeed for? And then are we exclusively breastfeeding? Do you want to breastfeed and pump and bottle feed? Do you want to do half breast milk, half formula? Like, I want to know from them what they want to do. I can't tell somebody how long they need to breastfeed for. So if you look at the AAP, they talk about um, you want to, and it changes, it goes back and forth from 4 months to 6 months. But if you're going to breastfeed, you can exclusively breastfeed for at least 4 to 6 months, and then you can introduce solids. Then that's based on your personal pediatrician, the recommendations at that time. They switched with both of my kids. So I always say talk to your pediatrician about that. But from that 4 to 6 months to that first year, your baby's primary source of nutrition is breast milk and or formula. So regardless if you're doing breast milk and or formula, they have to have that for at least the first year. And then at 1 year, you can decide, okay, do we go to cow's milk or some alternative non-dairy milk, or whatever they want to do, or you can continue to breastfeed beyond that. I've had moms where from the beginning, they only want to breastfeed for 8 weeks. And that's great because they get all that colostrum and the antibodies and all that kind of stuff. And that's the only reason they want to do it. I've had other moms that come out the gate and they just want to exclusively pump until they go back to work. So it varies so much. I have other moms that tandem breastfeed. They'll be breastfeeding their 2-year-old and their newborn. So I mean, there's endless possibilities as long as you just kind of talk with your pediatrician about the nutrition your baby should be getting.
Yeah. So talking, I guess one of the most important part here between the first and fourth month, yes, there's the breastfeeding there. And then as if you're moving
Hmm.
into formula and breastfeeding, but one of the most important part of it also is touching bases with your pediatrician as you're moving along that journey, going into that 1 year old of the baby and beyond that.
Yes.
So since we're talking about the part where we breastfeed and especially during the beginning phase, so is there a certain amount of time? I have been reading different things, such as like in when the baby is 3 months, you have to feed them this many times a day, then 6 months,
Hmm.
then 9 months. So is there a format to this of knowing when the baby is hungry? Is it every 2 hours? What's the method here?
Yeah. That's another one. It's kind of tricky. So in the beginning, it's pretty easy. Babies are going to eat every 2 to 3 hours around the clock. They need at least 8 to 12 feeds in 24 hours. And that's going to go on at least for the first 2 weeks to get them back to their birth weight. I'd probably be feeding more every 2 to 3, and you're going to have to be waking them up at this point. The first 2 weeks, all they do is sleep. So a lot of times you actually have to set an alarm and wake them up to feed them because we've got to get them back to their birth weight by 2 weeks. Beyond that, you kind of can go still you can get closer to every 3 hours around the clock, assuming baby's gaining weight properly, your milk supply is doing well, all the factors match up with it. Um, and then beyond that, once baby gets older, you can, and this again, I always go back to talking to your pediatrician because they're all a little bit different. And so as far as your milk supply goes, you can go that 4 or 5 hour stretch at night. Usually a baby will have one long stretch and they'll have a 4 hour stretch, and then they'll start adding on to it. And then they'll get a 5 hour stretch and then a 6 hour stretch. And then they're back up every 2 to 3 hours after that long stretch. So that usually it seems like that always kicks in around 11, 12 weeks right before mom typically goes back to work. It's like the babies know, like, okay, mom needs to sleep. So you'll get those 5 to 6 hour stretches then. And then once 4 to 6 months hits, you're introducing food. So it kind of changes a little bit. And then beyond that, it's kind of up to the mom. I mean, as long as baby's getting the nutrition that they need, it kind of depends on how often they feed. Like towards the end of my breastfeeding, I was only feeding once, maybe twice a day. And honestly, I think it was more comforting for me and the baby more than like nutritional value. Because my babies were a year and a half when we quit nursing. And so they were eating and, drinking water and all that kind of stuff. So it was more of a comfort thing at night than anything else. So once they get older, it kind of is a mixture of comfort and feedings.
So almost like the same thing that I'm hearing. It's about 2 to 3 hours, and then gradually or
Mhm.
slowly you start increasing that time frame, especially in the nighttime part of it.
Yes.
Mm.
Yes. Yes. And the main thing in the beginning phase is it's I mean, it's about the baby, but some babies gain very quickly and they do great with every 2 to 3 hours, but it's more for the mom's supply. So it's supply and demand. The more you demand it, the better your supply is going to be long term. So we don't like for moms to go longer than 3 hours in the beginning, just so we can get that supply established really well first.
Great. And that's good to know because a lot of us, like you said, every experts also, even though they may share similar fields and similar backgrounds, sometimes it's a bit different the way the information come. And that's what part of where you say check in with your actual pediatrician so you can know what to do or how to follow that format. But this is important also having a consultant who actually knows about this and how it actually works, like the supply, the demand. This is really good
Uh-huh.
information out here that we're learning. Myself as a soon-to-be mom, and I'm pretty sure a lot of other moms out there is going to really appreciate this information. So I just really want to say thank you so much for sharing these type of
Oh,
information as we're going
of
along.
course. Yeah.
As we were just touching bases on, the amount of time one should breastfeed, such as the hour. Also, another question I hear a lot is how long the duration, like for example, when you're doing the breastfeeding, is it 2 minutes, 5 minutes? What's the duration for
Mhm.
breastfeeding? Is there a format to that also? Everything here has to have a
I know.
format. How does it look like in the morning?
Yeah, it's so all of these things are assuming everything's going well. I mean, obviously there's different scenarios, but ideally you always want to put the baby to the breast, whether it be left or right, let them nurse, ideally for 15 minutes. And that's doing an active feed. And that's another thing. There's active feeds and then there's comfort feeds. An active feed, the baby is actively sucking and swallowing and moving milk. And a comfort feed, they're just kind of like pacifying themselves, which is also great for stimulation, great for supply, great for, comfort for the baby. But make sure they're doing an active feed. If they're efficient at the breast, they should be able to move all of that milk within 15 minutes. At the 15-minute mark, if they're still going to town, let them go. But if you feel like they're kind of slowing down or close to the 15 minutes, you can unlatch them, burp them, and then offer the other side. We always want to offer the second side. They may or may not take it. And that burping sometimes will relieve some of that pressure so they can continue to eat more. But we always want to offer. So if we start on the left side, let's say baby goes 10, 15 minutes, unlatch, burp, offer the right side, baby may only do 5 minutes, and that's fine. As long as they're content and they're lasting the 2 to 3 hours. But when you go for the second feeding or the next feeding, you want to start on that right side. So you want to alternate sides each time. But ideally, 15, it shouldn't really take more than 30 minutes to feed on a normal basis. Now, you're going to have times where a baby, just like us, we snack sometimes, and sometimes we sit down and eat way too much, and babies will do the same thing. So you may have a quicker feed in the morning. Your prolactin levels are higher from 4 to 7 a.m. And so you're going to produce more volume then. So babies are going to get fed quicker, ideally, versus as like you start out with a really high volume in the mornings, and then throughout the day you're feeding so frequently that your supply just naturally goes down. So like 5 to 8 p.m. Babies may feed longer. They may do both sides, whereas in the mornings they may only do one side. So that's why it's always good to offer. So it gets kind of tricky, but I always say like after the 2 week phase, once you get into 3, 4 weeks of age, you're going to kind of really see your baby's pattern. My son would only feed for 7 to 10 minutes on one side and he was done. And he was the fattest baby. And my pediatrician couldn't believe that that's all he was nursing, but he got a lot of milk, but I also had an oversupply with him. So there's a lot of factors. You've got to look at mom's supply, baby's weight gain, all that kind of stuff. So, but ideally 15 minutes per side.
Good to know. Good to know. Thank you. You just mentioned supply and demand earlier.
Mhm.
And that's one of the things when it comes to a mom, especially for first time mom, if they're doing this a second time around, they definitely have more knowledge, more experience in this area. But for myself or someone out there who's a first time mom, how do they take care of
Mhm.
themselves health wise when it comes to breastfeeding? And is there certain things that they can use to help bring that supply in?
Yes, that's a really good question actually, because being a first-time mom, this is very unknown to you. This is very unknown to baby. It's unknown to dad or partners or whoever the support system is. So it's a lot to take in, and it's an automatic stress load, and that's what we kind of want to avoid. So it's good to have a support system, whether that be family, friends, lactation consultant, whoever that you can go to and get support both mentally, emotionally, physically. Stress is one of the biggest indicators, not to necessarily decrease your supply, but it inhibits your letdown reflex. And so when your stress endorphins go up, whether that be from just lack of sleep, things not going right, uncertainties, all that kind of stuff, that inhibits your milk ducts can't dilate, and it doesn't allow that milk to flow out. So your body stays very tense and it holds on to that milk, and you're not able to have a good letdown, and then baby struggles sometimes to be able to get the milk. So being able to like be in a really calming, low key environment to breastfeed. And I tell a lot of my moms, babies are having a hard time with the letdown, I'll have them get in a warm bath. Now, obviously, this is assuming, mom's not a fresh C-section, baby's umbilical cord is already off, all those things. But getting in a warm bath, putting some lavender essential oils out, and just if it's calming for mom and baby to be in that bathtub, they breastfeed so well. So it's a really good late afternoon, the witching hour type thing to do. Um, but yeah, just decreasing stress, staying hydrated. Hydration is huge. So I don't really worry so much about what moms eat. Obviously you want to have a good balanced diet, but it's not going to make or break you with breastfeeding in your supply, but hydration will. So little easy things, you can get on Pinterest and find thousands of ideas. But coconut water has been shown to help increase supply. Still cut oats, like oatmeal, overnight oats is really good. Flaxseed, brewer's yeast. Those are all things at home that you could make things. Lactation cookies are a really popular thing to make. Galactagogues are probably the next step. So after, you've got foods you can eat, making sure you're drinking lots of water. Those are more specific to what's going on with mom, and there's so many of them. I kind of don't even want to get into them because I don't want moms to feel like they have to go out and buy these things. But I do recommend talking to a lactation consultant about them first, because the market is flooded with them and not all of them are really worth your money or the best. So if you feel like you're struggling with supply, I would say definitely reach out and do your research before you start getting into galactagogues.
So a lot of information and a lot of different ways, like you mentioned, to help bring that supply in for the breast milk. But most
Yeah.
importantly, reaching out to a lactation consultant, getting that information on what works and what doesn't work out there, because it may vary depending on the person individualized. I like I said, some of these things are
Mhm.
really individualized based also, because everybody is a little
They
bit
are.
different and unique. Because we're sharing all this great knowledge, I know we're learning a lot about breastfeeding and how to help the babies a little bit, but most importantly, also, we have to come back to the mom a little bit when it comes to when she's breastfeeding. I have read and heard a lot about the pain, the soreness in the nipple.
Mhm.
So, for moms, what are some of the causes sometimes that leads to that, and what's the best way to prevent those?
That's a really good question. And it kind of goes back to we were talking about that initial latch earlier. So making sure that that initial latch is really good. I highly, highly recommend if you're in a hospital that provides lactation consultants, to you get them in the room. Don't wait on them to come to you, but try and call and have them come in if you're needing help. The nurses on the floor are typically great, but they're not certified and they're busy. They have a lot of patients. So if we can try and get a lactation consultant in, that just to even if ever you feel like everything's good, just to make sure that everything looks good before you go down that road of, cracked and damaged nipples. Um, I like the preventative measures. So you can hand express some breast milk onto your nipple right after every feeding. You hand express a few drops, rub it on your nipple, and then just kind of let them air dry for a minute. And that's going to help prevent the damage from happening. Nipple creams are really good. There's a ton of brands. Those are always good to try. Once you have the damage, it's then you kind of I mean, the creams will work, but I always have my patients move on to something a little bit stronger so they can get healed quicker because breastfeeding while you're damaged is toe curling pain. It's horrible. I do really like hydrogels. That's a go-to for me. So those are always good to have. Most hospitals carry them. So you just have to check with your local hospital. If you're in pain in the hospital, they may have them. Coconut oil. I'm also I try natural stuff before I go on to any type because it's baby's mouth and it's all safe, but I like the coconut oil and the breast milk. I think those two things can heal everything. They're great for diaper rashes, but they do work really well for nipple damage. So those are really my go-tos, but really finding out bottom line what's causing the pain, which is usually a shallow latch. It could be a tongue or lip tie. So having a lactation consultant do an oral assessment is always a good idea too.
Most importantly, while you're at a hospital, if you can and it is available, request a lactation consultant to come in, make sure that you are positioning it the right way. So when you go home, you
Yes.
kind of have that idea also. And if not, coconut oil or just the milk itself before moving on to
Yes,
something,
absolutely.
and we touched base on this in the beginning of the video already. Not everyone can breastfeed sometime. Some moms are not able to do that. What are some recommendation or advice you give to those moms out there to whatever they're providing for their baby, that they're taking the nutritional route or the safe route for the baby?
So when I do have moms that need to do both or supplement for a little bit here and there. Basically, I just educate them on the formulas. I don't really pick one for them because I mean, cost alone is a big thing. So a lot of times I'll again go back to your pediatrician, talk to them. A lot of times they carry samples that they're able to give um, the parents and they can kind of try that. I do let them know though to make sure that it's prepped properly. So a lot of people that are hardcore breastfeeders, they'll, talk bad like formula's poison, it's so bad for your baby. And it's not even so much the formula, it's how it's prepared. If you're using like water from a restaurant tap machine, it's probably not the cleanest water. So you really want to stay with like the sterile water for your babies and make sure that it's prepped according to the back of the can if it's a powder or whatever, and that you're using it properly, that you're not letting it sit out for 4 hours after it's made or after the babies drink it. Like it's only good for 1 hour once the baby drinks from it. So just educating yourself on formula in general in that way is really well. So as far as what type, some babies can't have dairy. So there may be a certain brand that they have to have, or there's babies got GI upset. So I always say just start with what your pediatrician recommends, and then they can kind of work with you up through that. But it just to know that it does take up to 2 weeks for the baby's gut to clear. So let's say we start one brand and then it's not setting right with the baby. So we go to the next brand, give that second brand at least a couple of weeks to make sure that that the baby's stomach and guts adjusted.
I guess one of the key concept here would be patience, right? Taking the
Yes.
mom or the parent along with the support person, learning to be patient during this transition, because 2 weeks can feel like a very long time when you have a newborn or a new baby. But it's important for us to understand that that's the time frame it takes as you're changing over a formula or you're trying to find out what best works for your babies.
That is huge. And it's one of those things that's hard to talk like to really prepare someone for, but you have to remember your hormones are kind of out of whack for the first, few months, and you're sleep deprived, and this is new to you. This is new to dad or partner. And that's something I try and stress too is not only are you going through a hard time physically and emotionally and mentally, but partners struggle a little bit too because they don't know how they can help. And so and I have a list for partners if anybody needs a list of things they can do, but just little things. Like my husband took over bath time, and that was his thing. Every single time he did a bath, I hardly ever have bathed my kids. And so but it's nice because I knew every night I could either sit and relax and do nothing. I could clean the kitchen after dinner or whatever. I knew I had that time, and it was so nice to look even, and it wasn't that long, but it was still just, I knew I had like quiet, for that
Yeah.
amount of time. So that plays a big part into it.
Absolutely, absolutely. I can only imagine with being a new mom and just wanting to do, just being pregnant sometimes costs so much tension. Am I doing the right thing? Am I eating the right thing for the baby? So you can't imagine
Yeah.
when you have that little bundle of joy in your arms and you're like, oh my gosh, I need to be with it all the time. But learning to take that break, letting that support partner, that spouse, or whomever is there to help you out, letting them take a lead here and there so you can take that break. The mom can take the break for themselves
Yes.
to just relax and debrief a little bit is important too during this time.
Yes, it is.
So these, I should probably stop reading stuff all the time also, but these are some interesting myths I have heard. So here we have you, the lactation consultant, and you either bust this myth or you confirm them. I don't know. So
Okay. Okay.
one of the first thing I hear is that the breast sags after breastfeeding. Is this a myth or not?
I think it's a myth. I mean, I think that one's still a toss up, that your breasts are going to get full of milk regardless if you breastfeed or not, and they're going to go through engorgement either way. We do try and slow it down quicker if we know the mom's going to formula feed, but they're going to get big. I mean, I'm talking like as big as they are in the third trimester, they get even bigger after delivery. So there's a lot of stretching, a lot of connective tissue, being stretched to its max. So I think regardless, they're gonna, like, where else are they gonna go? So
Yeah.
unfortunately, I think that one's pretty true. Or it's a
Oh,
myth because it's gonna be no matter what.
and this was one of the things actually when I was talking to one of the other experts on the nutritional factors. She's saying our body may never be the same again after delivering a baby.
Never.
And we better get accustomed or used to accepting the new version of who we are and falling in love with that part of it.
Yeah, I think that's one of the things that kind of nobody talks about, that like all the changes that, like, your stomach changes, your bladder changes. Um, so like just little things that weren't a big deal before. And now it's like I'm 7 years into being a mom and my body's still messed up. So, but yeah, it's gonna change no matter what.
Yeah. So changes will happen whether we want it or not. So the second one is baby finds it hard to latch on to the nipple during breastfeeding. Is it a difficult thing for the baby just as much as it is for the mommy, or the baby is able to automatically get into it?
So I think it's more the babies. So sucking is a comfort measure for them. So babies have a very good suck reflex. So I don't think. I mean, now again, as assuming baby's not like severe premature or anything else like that, but um, I think it's more positional. That's where it gets hard. And also, if we have a really good position, we just need to make sure babies aren't too sleepy. And jaundice can cause that. Diabetes can cause that. So, like, or gestational diabetes, if babies' blood sugars are off, they're way more sleepy and hard to wake up. But overall, if everything's going well, babies should be able to latch great and suck great. There's just a couple of things like when babies are nursing to kind of keep them entertained, like to keep them nursing, is like stroking the side of their face on their cheek, kind of like stimulates that suck reflex, tickling the bottom of their foot. Sometimes you need to undress them down to their diaper, and that kind of wakes them up a little bit. Being skin to skin always helps encourage them to do a good job too.
And I have one last one, and this one I hear often too. I am a bad mom if I cannot breastfeed.
Yeah, that's the one I hate the most. And but I hate it, but I get it. I was very determined to breastfeed. And I feel like if somebody told me for whatever reason, my supply wasn't good, maybe whatever, I would have been devastated that I couldn't do it. So I get it. I can't tell a mom not to feel that way. But I also don't want a mom to feel that way because she chooses to formula feed, because there's nothing wrong with formula feeding. Yes, I know majority of our, society breastfeeds right now, and I think that's fantastic and I love that. But I don't understand what's wrong with both. Like a lot of moms also feel like they have to choose one or the other, and you don't. You can do both. I mean, it's not a one-way street. So I I don't know. I wish there was an easy way to get over that. I think one good way is to stay off of mom forums. I have noticed that on social media, moms can be very aggressive and mean to each other, which blows my mind. So I like when parents have the professional support, or support of their families, if their families are supportive. I've even seen it within the family where they're just very judgmental. And at the end of the day, mom gut's real and you're into like whatever you're feeling, that's what you do. I think the only bad mom is the mom that doesn't feed her baby anything. So it doesn't matter what you feed, as long as you're happy and baby's happy and gaining, who cares?
And I'm so glad you mentioned that part. Knowing where you're getting this information from. This is one of the things I touch bases with all the other experts also, because there's so everybody these days think they're an expert at everything, and that's one of the
Yeah.
reason why when I did this health and wellness section, I wanted to make sure not just personal experience, which is really amazing to have, but actually bringing in
Mhm.
people that's licensed, that's registered, that have the knowledge on this topic. Because depending also for some people, depending on what culture we come from, what that belief system may be, all of those things play a fact. But as a mom or a soon to be mom, it's for me, I find it really important to speak to experts and get that information, making sure also their practice and model somewhat matches up to the mom. And sometimes when it comes
Yeah.
to, like you mentioned, the family factor, being able to tell, sometimes not just staying off of the forums, those are really important to also avoid sometimes, but being able to set certain standards and boundaries with family members and friends who may be pushing certain information that's not necessarily always the best. But one of the things I shared in some previous video is, once you become pregnant, and I guess throughout the journey, we can expect everybody is an expert in telling you what to do and what's the
Oh
best
yeah.
for the baby. So being able to set that limitation is very important. Overall, today, I think, Kendall, you really brought some great information to us, a lot of knowledge, also some personal experience and journey when it comes to breastfeeding and taking pressures off of mom, whether they breastfeed or whether they choose not to breastfeed. It was very informative. And I want to say thank you so much for taking the time out of your day to come on and join me on YouTube and sharing this information.
Well, thank you for having me. I love talking about this stuff and I love trying to get out there that, lactation consultants are there to support your goals, not to push you to breastfeed. So I'm hoping that if moms have issues or questions or anything like that, they're able to reach out to lactation consultant and get that professional support.
Right. And I know after people watch this video, they'll definitely want to know if they can get in contact with you or just get more information to learn more about lactation consultant. How can they reach you, or where can they get in contact?
So I have a website. It's kendalvaughnlactation.com. And that has all of my contact information. They can email me. Um, I have a Facebook and Instagram that I typically post. A lot of my patients are referrals from pediatricians and moms. So I'm not as active on there, but I do get a lot of messaging from there. But I try and do, some educational posts and stuff like that. So Kendall Vaughn lactation is my Instagram, and then Kendall Vaughn lactation is my Facebook. And then any information on how to get a hold of me is on the all three of those platforms.
Once again, thank you so much, Kendall.
Thank you.
So there you had it, guys. Expert Kendall Vaughn shared with us so many gems and so much information on breastfeeding, whether you choose to breastfeed or whether you choose to formula feed. I hope you guys like this video. Don't forget to give it a thumbs up. Drop me a comment below. That'll be really helpful and supportive to me and my YouTube channel. And I'll see you all next week. Bye for now.